welcome to Road to Relay. In Road to Relay, we will take a few steps alongside some survivors and their families as they navigate the cancer experience. No two people will have the same experience, but along the way you will find compassion, community, help, and most of all, hope. So far, we've met Marilyn, an ovarian cancer survivor, Gail, a caregiver who illustrated that while there are struggles in the journey, there are also rewards, and Scott and Keith, who spend their professional lives seeking to eradicate cancer. The Canadian Cancer Society brings together a community to support each other throughout the cancer experience. Volunteers are the backbone of the Canadian Cancer Society. Volunteers go through training programs to support cancer patients and their families with cancer information services, rides to treatment, peer support services, advocacy services, and many more. Volunteers gain the skills they need through lots of training, but they bring the heart, which is why these services make such a difference in the lives of people going through treatment. Cheryl and her husband Darcy are volunteer drivers for the Canadian Cancer Society. Not only do they drive the vehicles that transport patients to and from appointments, they schedule the days, pickups, drop-offs, and provide a personal and caring environment for hundreds of people who get more than just a ride. Let's meet Cheryl now.
After you and no one asks for your credit card,
right,
or your payment.
I understand you're a volunteer at the Canadian Cancer Society. Can you tell me exactly what it is you do there?
My husband and I together pick up people who are going to treatment. We pick them up either at the Cancer Lodge or at their own homes, or if they're staying with family or friends in the city, we pick them up there, get them to the treatment center, usually at the Alan Blair at the Pasqua, but sometimes people are going for CAT scans or something of that nature at the General, basically wherever they need to go, and get them to their appointments and then get them home again safely, and we enjoy doing it very much.
So how did you get started volunteering?
Well, I retired about 6 years ago, and my husband did as well, and we were looking for an opportunity to spend some time volunteering in the community. We've had family and friends in treatment prior to that, and we just thought that would be something that we would enjoy doing. And it would be, as my husband has said, it's a hands-on thing. You're not putting, $5 in a donation box. You're getting up in the morning and you're doing it, and you're meeting the people and you're helping them, and it's kind of an instant gratification. You get to meet some wonderful people, and it's hands-on, and that's what we enjoy doing.
So how does it work?
The information is usually distributed through the Alan Blair at the Pasqua Hospital, but also there's information available through the Cancer Society office as well. When people go in for treatment, they usually get a pamphlet, a group of information pamphlets, and in there is quite often the information that they need to contact the Canadian Cancer Society. We have a wonderful coordinator named Gina, and people get in touch with her. And then Gina has a list of drivers. I think we're at about 8 or 10 right now. I'm not sure how many people we have driving right now. There's been different numbers over the years that we've been doing it. And they get in touch with Gina, and Gina, bless her heart, organizes both Regina and Saskatoon, and she compiles a list for the day, and then a couple of days ahead of time, she sends that out to the volunteer driver that's driving for that day. So a couple of days ahead of the day that you're driving, you get a list of the people, their names, phone numbers, and addresses, and the time that their appointment is. And then you have to try to figure out a route that will get everybody to their appointment on time and get them home as expeditiously as possible. So that's the way it works. And Gina looks after both Regina and Saskatoon, and I don't know how she does it, because there's people calling in with last-minute things, but she gets us all going.
So do you use your own vehicle, or?
That's correct. One of the things about being a volunteer driver is you have to have a vehicle that's suitable to the task. So you need a vehicle that people can get in and out of easily, something that's four-door. And quite often you have people who have a walker, for instance. And so you have to have a vehicle that has a trunk or a back large enough for people to get a walker in. And sometimes you have more than one person in the car with you at a time. Well, most of the time you do. So it has to have some size to it. So yes, you use your own vehicle, and the Canadian Cancer Society gives you a mileage for to cover costs of fuel, basically.
So what about this experience do you find rewarding?
hands down the interaction with the people. They're very grateful for the ride, and they're happy to see you. You know, the treatment is difficult for people, and you can be there with a, you know, with a happy face, and you know, meet them. And a lot of people you drive consistently, you know, week after week or several times over a month, so you get to know them. It's kind of like picking up friends. So it's nice in that way. Both Darcy and I enjoy people, so it's nice to have a visit on the way.
But so you also had experience as a caregiver, I understand, right?
Yeah, when we started to drive, we hadn't actually been a caregiver at that point. That came after. We did have family who were in treatment, and they were from out of town, so we knew what it was like for someone coming in from out of town to try to, you know, have to go to the hospital every day for treatment. So we later became caregivers, or, you know, helpers with a family member that stayed with us during the time that she was in treatment.
Okay.
But that was after we had been driving for a while.
So any advice you would give to someone who was interested in volunteering at the Cancer Society?
I would say go to your strengths. You know, the kinds of things that you enjoy doing. Darcy and I both enjoy talking to people, meeting with people. We both, having been in jobs where, you know, figuring out how to read people and you know, trying to say the right thing at the right time, and knowing when to be quiet and when to kibitz, and both of us have been in that kind of a job in our lives, so we kind of play to our strengths in that thing. And I guess that's the best advice I would give, is to go to something that you feel comfortable with and that you enjoy doing.
Oh, so it's not just about driving, you're actually interacting with these people too.
Some people want to talk, other people don't. They have a lot of people in their lives that are dealing with the treatment aspects and the support aspects. We try to be more friends meeting for coffee, you know, a little more relaxed, a little more kibitzing and things like that, you know, go along with how the people are feeling that particular day. But, you know, they don't want to get in the car and talk about their cancer necessarily. They want to talk about the riders, they want to talk about their pets, they want to talk about their family. You know, they have enough people that are professional there to support them with their treatment. We try to just be friends, you know, just be, you know, people that they meet and people that are there to lend them a hand when they need it.
Well, Cheryl, I'd be thrilled if I needed a ride to treatment and you came and picked me up.
Well, we get back tenfold what we ever give. I mean, we meet the nicest people, and they're going through a tough time, but we just meet the most incredible people from all over the province, people who have interesting stories about their lives. People have come to Canada from different places, all walks of life, all ages, all socioeconomic levels, and that. I mean, you just meet such a wide variety of people, and you know, sometimes you can have a really good visit with people and share a few jokes, and they can hassle me about my driving. They say I drive like an old woman, but you know, those kind of things. I mean, we could just have fun with them, and then get them there safe and get them home as soon as we can, and you know, that's kind of the focus of the job. But it's long days. I mean, it starts early in the morning, it goes till, you know, late in the afternoon. We only drive a couple of days a month. There are some people that drive 1 or 2 days a week, but that's a nice thing about being a volunteer driver, is you can pick your times. So, you know, however many days you have available that month, they're happy to have you. So even if you could drive 1 day a month, you know, they'd be happy to have you on their list if you were available to do that. If you can drive more often, great. But they need the people and the vehicles there to get those people in.
Cheryl, thanks so much for coming in and telling us about your experience. I really appreciate it.
Oh, you're most welcome, Karen. It was nice to meet you.
You know, within minutes of having met Cheryl, I felt like I had an old friend. And what a way to end a chemo treatment, with that greeting you at the end for a ride home. Linda is a peer support volunteer. In order to provide peer support, you have to have gone through the cancer experience as a survivor, which makes this service so valuable, but also makes volunteering all the more admirable. Linda gives of herself and her own experiences to each and every person she contacts. Her warmth, humor, and knowledge would be invaluable to a person who is heading down a similar path. Let's hear from Linda now. So Linda, you're a volunteer for the Canadian Cancer Society. Can you tell me what you do there?
I am a peer support volunteer. I'm also a survivor, so I have taken training, and I am matched with various clients across Canada. There are items that I have had, treatments that I have had, surgeries that I have had, my diagnosis itself that they use as points, and they match us on those points, and I volunteer and call people and speak to them on the phone and help them through what they require at the time.
So can you tell me how that works?
What happens is they call into the Canadian Cancer Society and they will talk to a peer support coordinator. And as I say, we get matched on various items, whether it's treatment, surgeries, that sort of thing. And then the peer support coordinator will contact me and give me the client's information, ask me if I can take on another match, and then I have 48 hours with which to make contact with the match.
So they could be people in treatment or post-treatment, right?
They could have just gotten their diagnosis and they're looking for generally minor with regards to reconstruction. Some are based on the same type of cancer, could be our age, could be treatment, that sort of thing. Some are one-time matches, just one telephone call, specific to the reconstruction surgery in a lot of instances. Others will be multiple calls. It's not just a one-time call. Matches can last for quite a while, actually.
So what made you decide to volunteer?
My mother had died of breast cancer. She was 63. So when I was diagnosed, I was 46 years old, and I started treatment. Due to complications, I had 18 rounds of chemotherapy, and due to complications, I couldn't have a port or a PICC. So one of the gentlemen that I met through my treatment was a volunteer at the Canadian Cancer Society by the name of George. And each of my 18 chemotherapies had to be done intravenously. My husband, who was my caregiver, was not good with needles. So George, I would come to the clinic, George would meet my husband would go get a coffee, and George would hold my hand while they put the intravenous in for the chemotherapy. So it's kind of an homage to him, and it's kind of an homage to my mother. And I just felt like if there was something that I could do to help people with understanding what I've gone through. It's just my story that I share with them, so I don't give them advice. I just I share my story, and if I can help anybody, that's what I chose to do. And peer support was a perfect match in such that I'm working still. So I was always told I had the gift of gab, so most of it is done over the telephone. And I found time in my life for that. I make it a priority. So
what do you get out of it?
I get the satisfaction of helping a woman through her journey, answering her questions, being there. There's questions that are, kind of personal, and you don't even want to talk to your girlfriends about them. They're kind of, between two survivors, so to speak. And so that's it. I get a real sense of fulfillment when I've made a good match, when I felt like what I said mattered, when I feel a connection. You can really sometimes feel the connection with the person that you're talking to, and that makes my heart full.
So what's the training like? I understand it's pretty extensive.
There is. You can't take the training till you're 1 year post a recovery. And it was Actually, the way I kind of got recruited was that I took the living after cancer, the transitioning into the new you. And at that time, they kind of made an introduction about the peer support. And I had mentioned to one of the coordinators there that, that's kind of sounded like a good fit for me. And she was a little relentless and talked me into it and took the training. Now, the first call was extremely hard and scary, but I did it, and I'm glad I did.
So how many connections would you say you've made?
I was just looking at my numbers today, and I've got 21 closed files, and I have 4 currently open where I'm still working with matches. And and I've been doing this now for 3 years. So quite a lot of people I've talked to. It's actually kind of amazing when you look back. Sometimes I've had one instance where it's a second time match. I've had one woman twice where she's called back and specifically requested me. So that and alone was a good feeling, to think that that connection was made and she wanted it back. So.
Did you not use peer support when you were going through this?
I didn't. I would have to say that I really wasn't that aware of it. I found that in the beginning when I was diagnosed, for me, I found that all the information overwhelming. And I was very lucky that I had a good support system. I had very close friends, family, wonderful doctors, absolutely wonderful doctors. And I found that worked for me. I felt fulfilled. So I didn't use it. I do see the benefit of it now, but I didn't.
So, Linda, what advice would you give to a woman that maybe was just starting this cancer experience?
Ask questions. Read the information that's given to you. Don't be searching too much on the internet. I know that was one of the things they warned me about, and I'm glad I didn't. Talk to people, and I find the biggest thing is to accept help. I know that as women, we're primarily the caregivers, and it's hard for us. We manage our households, we manage our children, we manage our work, and then we're kind of throwing this cancer diagnosis, and we kind of have to give up some control in some areas and be willing to do that. Help and friends are a good thing. Let someone cook for you. Let someone clean for you. You're crazy not to. Enjoy.
What advice would you give someone that was considering volunteering to be a peer support person?
Like I say, for me, it's a great fit. I find it very fulfilling. The first time is very scary because you don't want to say the wrong things. They warn you that you're not a doctor. You don't want to give advice in any way, shape, or form. So my philosophy is I kind of start with the women and I just say, I'm going to tell you my story. And then I said, if you have questions, interrupt. If you want to know something, if you want to touch on a subject, stop me and we'll talk about that if there's, something specific. But I'll kind of give you my background. That's the way I start. So that way I find they get a feeling or a sense of knowing me and what I've gone through. And then from there we start on their journey. And then their questions become more specific because you hate to call and it's, I'm thinking about this reconstruction, what do you think, And because it all sort of travels together. It's not just the reconstruction, it's the losing of the breasts, it's the, it's the treatment, it's the, I don't know, your spiritual side, you re-examine yourself, and sometimes it's nice to talk to somebody about that.
And somebody that has been through it.
When you tell them your story, I think it opens it up for their questions rather than being so, kind of clinical about it or just to the point. I find it puts me out there and that's the way I like to approach it. So I would just say to people, don't be scared. You know, it doesn't take long. Everybody is probably on the phone at some point for an hour. You know, you talk to girlfriends and that. So that's the way I look at it. It's like talking to friends. I don't really look at them as clients. It's, you know, I like to think that on some level we've connected. Now I'll be quite honest, there are calls where it totally goes sideways, and it just, you walk away from that and you think, wow, did I blow that, or did I miss that, or there's more going on here? You know, there's a lot you have to be open to hearing in a person's voice too, that you can contact the coordinators and say, there might be more to this than just the need of peer support, you know, and then you pass that back to the coordinator and they make the call and contact the necessary people. So we're not really guiding or telling them what to do. It's just kind of sharing stories and sharing experiences, and that's basically it. And I find that's an easy thing to do. So like I say, it worked perfect for me. I work, so it's something that I can do in the evening, and it's my way of giving back.
Well, I would be delighted if I picked up the phone during crisis and you were on the other end.
Well, thank you.
Thank you so much. I appreciate your time tonight.
Thank you.
So not only does Linda offer support for her fellow breast cancer survivors, but that infectious, bubbly spirit of hers serves as a beacon of hope to show that there is life after treatment. And after treatment, there's also nutrition. So here with us today, we have Courtney Mackay. She's a registered dietitian at the Saskatchewan Cancer Agency, and she's going to talk to us about proper nutrition after treatment. Watch with me now. Back, we're here with Courtney Mackay once again. She's our registered dietitian from the Saskatchewan Cancer Agency. And today we're going to talk about survivorship and maintaining a healthy diet after you've been treated for cancer. Hello.
Hello.
What can you tell me about that?
So in the weeks and months following treatment, it may take a little bit of time for those side effects to improve. Your body's healing and recovering and continuing to be well nourished, and having a healthy, well-rounded diet with adequate protein is going to help you in that recovery. Once you're through that recovery and thinking about the rest of your life, our focus shifts again, sort of back to that prevention side of things, where we're trying to prevent a recurrence of your cancer or prevent a secondary cancer or other chronic diseases.
Good point.
So our focus shifts back to having lots of vegetables and fruits and whole grains and living an active life and limiting alcohol and sodium
Right.
and things like that. All good things for healthy living.
So it's a matter, though, of finding your own pace back, because you still may
Absolutely.
need to put on a couple of pounds.
Exactly.
And
Everybody's journey is an individual thing, and some people may have lost weight during treatment, and of course we want to regain to a healthy body weight. And if you've had surgery or something like that, you may have a new normal to what foods you tolerate, and you may have to discover those over time.
right.
The alternative to that, this might be the time for some people to look at achieving a healthy weight by losing weight.
Okay.
Because a healthy body weight is probably one of the most important factors in preventing cancer and other chronic diseases. So,
But they should do this by being in contact and getting their own personalized plans for dietitian, right? Because everybody's going to be different, as you said.
absolutely, we're here to help guide our patients through this. And when we're looking at any sort of weight loss plan, we want to do that in a smart and healthy manner,
Right.
not looking at extreme weight loss programs that are not maintainable for a lifetime.
Right, so don't eat grapefruit for 2 weeks and figure you're good to go, right?
Exactly. We want to aim for a healthy weight loss of 1 to 2 pounds a week while you're being active, so you can maintain some muscle mass and lean body tissue. So.
And as you become being active again after treatment, your nutritional needs may change, right?
Absolutely, for sure. If you're able to be quite a bit more active, you may actually need to eat more food.
Okay, but in general, we go back to...
Exactly what Canada's Food Guide has told us. Eat lots of vegetables and fruits, try and focus on whole grains, have lower fat dairy products, and then also choose more alternatives from those meats and alternatives, your dried beans and peas and lentils and nuts and seeds as sources of protein and energy.
And so I think in general, the idea is eat healthy. You can have things like sugar, but in moderation, right? Courtney, thank you so much. It's been a real pleasure, and I hope everybody took some benefit from this. If you have specific questions, remember, talk to your own dietitian. Thanks for joining us. Volunteers are the lifeblood of the Canadian Cancer Society. You've met a couple here today that are representative of hundreds of Canadian Cancer Society volunteers. It's how they can take a modest donation and stretch it to provide services for so many. So consider donating, and if you're not in a position to donate, consider volunteering. There are plenty of opportunities. That's Road to Relay for this week. Thanks to Cheryl Shirley and Linda Patton, as well as Courtney Mackay. We're back every Wednesday at 6 p.m. on Access 7, leading up to the Canadian Cancer Society's Relay for Life on June 8th at Douglas Park. Be sure to join us. Or watch the replay of Road to Relay Sundays at 6 p.m. Or look for us on Demand. Hit the On Demand button on your remote or go to Channel 200. Select Access 7, Health and Lifestyle, and then Road to Relay. Thanks for watching, and bye for now.